Senator Ontiveros is recognized. After Senator Ontiveros, Senator Laila. And then, I'd like to acknowledge pala Senator Gordon. Thank you.
Thank you, Mr. Chairman. At magandang umaga po sa lahat ng ating mga resource persons. Pero pasensya, special mention sa mista ng late husband ko na naging PNP officer din. And my friend, hindi ko siya matawag na bato kasi we always called him Doroy, Chief PNP de la Rosa. At ganun din kina Director Odi, Director Ruel, Director Picoy, Director Ed, mga mista rin at opo, mga mista rin, mga kaibigan din po. Yes, Mr. Chairman. Dun po sa Senate Bill number 3, siguro just 3 also very quick comments, pati dun sa itinanong ni Senator Grace kanina. Kasi gaya ng guidance din ni Chairman, gusto kong dumiretso sa Senate Bill 8 at saka yung resolution na mas may kinalaman din sa health at saka youth and education aspects nung topics natin ngayong umaga. So doon po sa amendment ng Comprehensive Dangerous Drugs Act at creation ng Presidential Anti-Drug Authority, yung 2 quick comments ko po ay, Mr. Chairman, it's unclear how the creation of this PRADA will bolster the country's response to drugs. Most of the bureaus do not appear to add anything to the response beyond coordination, which can already be accomplished by enhancing the current board. So, ako po, Mr. Chairman, ayoko pang mag-give up sa current organizational setup under Comprehensive Dangerous Drugs Act. Pero gusto ko pang tignan, posible pa ba at paano pa ba i-maximize yung actual na operationalization nila at saka effective response dito sa concern natin sa illegal drugs and trafficking. And pangalawa, Mr. Chairman, there could even be an issue of hierarchy for a bureau headed by an undersecretary to supervise and sanction departments headed by secretary. So just to put that on record, Mr. Chairman. And my last comment po for now dito sa Senate Bill number 3, something po na tinulungan tayo ni Senator Grace i-point out doon sa interpellation nila kay Director General. Tungkol po doon sa internal affairs system. Napagkasunduan nga po nilang dalawa, Mr. Chairman, na in fact, yes, the law provides that a civilian should head the IAS at sa ngayon hindi pa yun po ang isinasagawa. Gusto ko lang pong paalalahanan si Chief PNP na kapag po sinunod na yung batas na iyan, it would not become External Affairs Service. Kasi naalala ko rin po, ang original na pangarap ng PNP, it is our national police, national in scope, civilian in character. So, pareho pong kalikasan ng buong PNP at yung mamumuno sa IAS. So those are my initial 3 quick points. Also pala, Mr. Chair, na yung isang concern po na pick up ko po ngayong umaga dun sa latest inquirer list. In fact, meron po tayong mga kababayan na nag-voluntarily submit sa pamamagitan ng Oplan Tokhang, pero they ended up na patay. So ito po ay isang concern po natin. So moving on, Mr. Chairman, dun sa dalawang mas health-related na agenda natin ngayong umaga, yung Senate Bill number 8, providing for affordable drug rehabilitation treatment for PhilHealth beneficiaries. Further amending din naman po yung, so further amending RA 7875, opo. So, yung mga points na gusto kong i-contribute sa discussion would include the bill would make drug rehabilitation treatment available to all PhilHealth beneficiaries and signal a public health approach in the war against drugs. Kaya, Mr. Chairman, na-appreciate ko po yung point ni Sec. Rojas kanina na aside from being a law enforcement, criminal justice concern, yung concern natin sa illegal drugs at trafficking is also a social concern and a health concern. And for that reason, Mr. Chairman, gusto ko pong i-commend ang Senate Bill number 8 for recognizing that drug use and drug dependence is a public health issue. At maraming salamat kay Asik Punsalan for going into detail on that. Mr. Chairman, we need to shift the focus of this war on drugs from punishment to treatment. At kaya na-appreciate ko po yung ating Committee on Rules secondarily referred itong Senate Bill number 8 sa amin ni Sen. Greg na Committee on Health and Demography. So, further, Mr. Chairman, nasabi na rin po ng mga PhilHealth officials natin, of course, primarily si Chairwoman Secretary of Health Pauline Ubial at pati si dating Chief Executive Officer Alex Padilla na in response po dito sa ating bill, PhilHealth funds are not enough to cover, ito po yung initial assessment nila, not enough to cover the costs of rehabilitation for drug dependents, lalo na po yung prolonged residential services. Ang ating pong Department of Health, Mr. Chairman, already recommended a more cost-effective program, including po counseling, psychosocial support, a 2-week drug rehabilitation program in acute cases or in the acute phase, at saka training of local physicians to evaluate drug dependence and categorize, yung classification na sinabi po ni ASEC Punsalan, categorize them properly for appropriate intervention. So, maganda rin po yung pagbibigay diin nila, Mr. Chairman, sa local physicians kasi po talagang yung pillar ng health service providers sa isang pangarap nating universal healthcare system is very relevant kahit po dito sa ating problema sa illegal drugs and trafficking. Further, Mr. Chairman, pursuant to its mandate and in consideration of its actuarial limitation, at ito po lagi pong binabantayan ng PhilHealth bilang po isang GOCC, PhilHealth officials committed to come out with an extended, kasi po sa ngayon ang mairekomenda ng DOH 2 weeks acute phase, but PhilHealth committed to come out with an extended benefit package to respond to the magnitude of the drug problem. And last comment on this before I go to a few questions on the bill, yung PhilHealth Board, led by Secretary Pauline and Acting CEO Buddy Aristosa, is studying and considering the following benefit packages, dun po sa case rate na sinabi po ni Dr. Soria. The following benefit packages for drug dependents. Case rates on mental and physical abuse of different substances, accreditation of drug rehabilitation and treatment centers for drug dependents, coverage for hospital, facility, and physicians or psychiatrists' fees na makover din po, Mr. Chairman, sa case rate, and inclusive or multi-tier case rates based on the classification na sinabi ni ASEC Punsalan, classification of the drug dependents and phases of rehabilitation. I have just 4 questions, Mr. Chairman, sa ating pong resource persons, lalo na po sa DOH at PhilHealth about Senate Bill number 8. At I will be asking them, Mr. Chairman, sa konteksto ng isang framework na gusto ko sanang idagdag sa ating heavily law enforcement approach sa drugs issue. So, mas yung public health perspective, yung lente po ng tinatawag in 90 countries already using these strategies, yung lente po ng harm reduction strategies. So, unang tanong po, Mr. Chairman, can the current, whether po maybe si ASEC Punsalan at si Director Soria, can the current bill, the current provisions of Senate Bill 8 be expanded to cover outpatient treatment and community-based treatment, sige, kay ASEC Punsalan, currently being developed by the Department of Health?
Madam Senator, yes po. In fact, we are already drafting in coordination with your and report to your office, being the Senate head on health. We have already responded to your call, and it is doable, and we are in response to your query, and I think also Dr. Pons here is also aware of that. Also, although the limitation as of now is the fact that yung po kasing rehabilitation patients, ang PhilHealth po kasi is more of dun sa detoxification phase nga lang. Hopefully, we could expand it more so that it will be more responsive. Plus, yung pong aftercare. Kasi po, kung iti-take mo yung treatment period as by the Honorable Senator Lacson, kung gaano katagal po, mauubos po yung ating actuarial funds. Kaya we have devised a way. And in fact, just for ano po, and you know this, Madam Senator, is also the response of the corporate social responsibility in addition to the present budget. Kasi budgetary need po, talagang hindi po tatagal yung actuarial ano natin. But with the response to the call, ang ating pong mga malalaking korporasyon could enable or facilitate some more fundings para po dito sa drug rehabilitation program po natin. Thank you po.
Salamat, Mr. Chairman, dun sa shout-out, kumbaga, ni ASEC Punsalan sa ating private sector din. Para gaya ni sinabi din ng isang resource person natin, maging holistic yung approach. Baka po yung aking dating colleague sa PhilHealth ay meron din gustong idagdag sa tanong ko pong ito.
Madam Senator, we're closely coordinating with the Department of Health on this issue, on the measures that we will take as far as addressing the drug problem is concerned. It's a question kasi, ma'am, of who should do what. So whatever the DOH will pass on to PhilHealth for coverage as far as benefit is concerned, then we will take charge of that. And the Secretary of YAL has signified her intent for PhilHealth to focus on personal services and for DOH to focus on the public health side. And we will closely coordinate with DOH in making that concrete, that commitment of the Secretary concrete as far as the drug problem is concerned.
Salamat po, Dr. Pons. Next question, Mr. Chairman, and it really goes into rehabilitation and harm reduction. So, yung harm reduction po na hindi lang siya articulated sa ating Dangerous Drugs Act, for example, but which I will also try to introduce. Dahil, in fact, meron ng provisions doon na are of the nature of harm reduction, lalo na po yung preventive, yung education na sinabi ni Chairperson Aiza kanina. So, expanding coverage to people who use but aren't yet dependent. So, may ganong classification. They use but they're not yet dependent. Could be important as a preventive measure to keep their drug use from getting worse and is much more cost-efficient than treating dependents later on. So dito po, Mr. Chairman, ang pinopointed ko, it's important to consider that there are people who use drugs who are experiencing problems, for example, work-related, relationships, etc., who need or want to seek help or treatment, but who are not diagnosed as dependent, at least not yet. So sa ganyang pong, kung mahuli natin sila, I don't mean huli as in arresto, but kung makatch natin sila at that point in their life, anong mga, if I could already start to use the term harm reduction, ano yung mga harm reduction strategies na aware na ang DOH, na gusto nyong to bring to the attention of the committee na magandang mas i-consider namin dito sa Senate Bill number 8?
Madam Senator, we have that program po in place. Ang ano lang po natin kasi, this is more of mental health na rin. It is aggravated by emotional conditions, problem situations, and depression. That is why they resort to taking in, not with the intent of being really magiging addicted sila, but in response to the present need like depression or falling in love na hindi nagustuhan, ng nililigawan, mga ganon. So, and then they resort to when they go to parties and all this, that's why the youth dito po are also highly affected. So, in the form of parang preventive aspect, i-consider po natin yung as a part of the mental health program po natin, which is actually integrated. And we have our hospitals also having the Department of Psychiatry and mental health programs enhanced as of this time, Madam Senator.
Thank you, Mr. Chairman. And in fact, when I was on the PhilHealth board, PhilHealth had already begun way
Yes.
back in late 2014 to start to develop, for example, mental health benefit packages. And salamat sa pagbanggit nyo, ASEC Punsalan, tungkol sa mga comorbidities of drug dependence, kasi they point out other public health concerns of people who use drugs to different degrees, no? Yung TB, pati po yung HIV. So kahit po yung ating response sa HIV and AIDS, may implikasyon po itong paano ba natin i-conduct o di i-conduct yung ating anti-drugs campaign. Yung next question ko po, Mr. Chairman, particular for PhilHealth, pero dito pa rin po sa Senate Bill number 8, and in relation dun sa relapse cases na nabanggit na rin ni ASEC Punsalan kanina, how do you anticipate na PhilHealth coverage be applied to people charged under RA 9165? Kasi the first offense for the use of drugs, offenders are caught, then diverted to treatment. Can this criminal justice health intervention be charged to PhilHealth, or final na po yung parang division of labor nyo sa DOH na personal services tayo sa PhilHealth, public health ang sa DOH? Dr. Pons.
Madam Senator, the bottom line as far as coordination with DOH is concerned is the PhilHealth efforts will complement the DOH efforts. So I think we'll be, although I think PhilHealth will be more involved on the personal care level and DOH on the public health aspect. But as I said earlier, the details will be worked out very soon. Actually, it's already being worked out. It's ongoing, ma'am.
So thank you.
Madam Senator,
yes,
can I add?
ASEC Punsalan.
You know for a fact that the chairman of the board of PhilHealth is the Secretary of Health. That is why, as Dr. Pons has mentioned, definitely it is also under the realm of the Department of Health. And PhilHealth actually is an attached GOCC agency of the Department of Health to and PhilHealth. So related po. In fact, I am also the head of the Committee on Accreditation, working with PhilHealth and working with you. So that is that symbiotic relationship po. So it is actually even taken up in the board, the PhilHealth concerns, by in the ExCom of the Department of Health. Thank you po.
Salamat, ASEC Punsalan. And I'm sure our lead chairman of the lead committee on this inquiry, and together with my committee on health and demography, we will eagerly await the details in the wino-work out nyo, yung sinabi ni Dr. Pons. Mr. Chairman, I will skip questioning for today, Senate Bills 21 and 48 for future hearings, to go straight and last to the proposed Senate Resolution 19, directing an inquiry in aid of legislation on effective drug prevention and intervention for the youth. And here I am sure that Chairperson Aisa will be one of the most helpful among our resource persons. I'd just like to point out, Mr. Chairman, that according to one news report, the Mandaluyong LGU in 2015 conducted raids in two so-called open parties, reportedly offering sex, drugs, and alcohol, resulting in the arrest of 146 persons, of which 80, more than half, were minors, and 52 of them between 11 to 15 years old. So what are kids this young doing in such parties? And in a recent event, 5 young people died due to drug overdose. According to a study, street children were nearly 3 times more likely to use illegal drugs, almost 9 times more likely to use inhalants. So also, Mr. Chairman, pointing out not just the public health aspect of our drugs concerns, not just the law enforcement aspects, but really the poverty, which I would still argue, kahit po sa ating highly charged law enforcement-centric situation ngayon, palagay ko po, Mr. Chairman, yung kahirapan pa rin ang pinakamatinding problema. In fact, creates the atmosphere for our drugs problems, also our drugs concerns. According to statistics released by the DDB, for 2014 naman po, Mr. Chairman, 8% of total reported cases from residential and outpatient facilities were out-of-school youth. Kaya sinishare ko po, Mr. Chairman, yung concern ni Chairperson Aisa para dun sa ating community youth, lalo na po out of school. 4% of these recorded by DDB 2014 were students, and the youngest reported case involved a 9-year-old patient. Studies have shown, Mr. Chairman, that ito po gusto kong bigyang din ulit yung harm reduction strategies na pangbalanse dun sa ating law enforcement strategy. Studies have shown that the global war on drugs pursued by some countries, characterized by a mainly punitive approach towards those who supply and use drugs, has not only failed to end drug use among young populations, so focus pa rin sa youth, but has also brought more harm. Sa halip na harm reduction, it's brought more harm to the youth by raising the health risks of drug use, yung comorbidities na sinabi ni Asik Punsalan, restricting young people's access to effective services. Kung may isang kabataan, meron na siyang drug problem, baka matakot siyang lumapit sa kanyang Department of Health kasi highly criminalized din yung atmosphere. Reducing access to essential medicines, undermining children's rights, further destroying families. Nakaka-destroy na yung poverty, nakaka-destroy na yung drug dependence, makaka-destroy lalo yung heavily punitive approach, destroying families, fueling crime and violence. So yung irony, Mr. Chairman, na we are addressing drug-related crimes, pero pag heavily punitive ang approach natin, the irony, nag-fuel pa ng further crime and violence. It even, sa documentation po sa ibang mga bansa, pati sa selected states sa US, it even fuels more violence against the police forces. Pag overly heavy sa punitive ang approach natin, and then creating new dangers. Ang tanong ko po sana kay Chairwoman Aisa, Chairperson Aisa, dahil po yung line of pero I heard hindi pa po kayo misis. So Chairperson Aisa, yung isang line of thinking ko po sa ngayon, itong regarding drug testing, meron po kasing argument na it's not effective in deterring drug use. I'd like to seek your wisdom on that. Research has found that there's no significant difference in marijuana use or the use of other illicit drugs, whether or not the school has drug testing of any kind, drug testing of students based on cause or suspicion, pati po drug testing of athletes. At baka si Kauban, Senator Manny would also have some thoughts on this. Pero, Chairperson Aiza, ano po yung balak sa ngayon ng ating NYC in terms of drug testing in schools or not?
Ma'am Senator, well, since it's only my third day sa pagtatrabaho, ito po about regarding the issue of drug testing in schools, no? Yun po yung dapat pa namin isa sa mga kailangan pag-usapan. But, personal opinion na lang po. Meron po akong kaibigan na isa po siyang magulang. And ang eskwelahan nila ay isa sa mga natukahan ng mga drug testing na yan. And nakakagulat because lumabas dun sa eskwelahan na yun na mayroong drug dependent na tayong kabataan na nasa mga as young as 11, 12 years old. So I think what ang ginagawa po nito, so opinion ko ma'am, it's not the opinion of the Commission and the NYC, is awareness sa mga magulang din. Kasi alam po natin na isa man po sa mga rason ng drug dependency ay ang kahirapan, malaking bagay din po dyan ng parenting. And siguro po para po doon sa mga magulang na of course, mahirap ang buhay ngayon, kailangan nila magtrabaho, at least aware sila na, teka, may ganito tayong problema. We have to do something about it. Siguro ma'am, ang is just to make guidelines, just to be sure na kumbaga hindi sila mapapahiya, masigurado pa rin na anonymous, para lang hindi magkaroon ng impact din naman sa kanila. Pero ma'am, may I touch on the subject also? Kasi po nabanggit nyo kanina about the parties, no? And another friend, hindi pa po ako nakaupo nito sa NYC, na nabanggit niya po sa akin because sabi niya gusto niya na idulog ko sana sa PIDEA. Ngayon po, isa sa mga nagiging ika nga ay gateway ng mga ganyan ay ang mga apps, no? Yung mga date apps, kagaya ng mga Grindr, Tinder, mga ganyang mga bagay. So, may tinatawag po silang chemsex. At ito pong chemsex na to, ang ginagawa po ay, wala po kasi ako sa Grindr for obvious reasons. Pero, I think ang ginagawa po dito ay, meron silang tinatawag na sorceress. Okay, ang sorceress, ito yung source nila ng mga drugs, and pupunta sila sa party, sa mga party na sa bahay ng kung sino, or probably a hotel or a motel, and they use drugs and then engage in sex. So it's actually, I think isa rin po ito sa, I know it's medyo malayo na, pero I think isa rin ito sa mga rason ng pagtaas ng ating problema naman sa HIV also. So, yun din po yung sana matugunan natin. Kasi in terms of the youth, ma'am, we cannot really solve the youth problem if we don't speak their language. So it's very important na talaga po na sa bawat area ng ating mga ehensya, ng mga department sa gobyerno, talagang mapakinggan po kami because we speak the youth's language, and we will always make sure that we have policies to help you in terms of solving this problem. Thank you.
Senator Risa, with all due respect, kindly wrap up. You know, I had intended initially to terminate, suspend, or adjourn this hearing at 12, but we still have 3 of our colleagues who have yet to ask questions. So anyway, we can tackle other issues during the next hearing. Most of our resource persons are very busy people. So, and we're happy that they're here. We're thankful. So kindly wrap up.
Will do, Mr. Chairman. Salamat po. So, yung last 3 questions ko, isang ano ko na lang, tas kahit pabaon na lang kay Chairperson Aiza, even if you could respond to the committee in a future hearing. Pero para lang ma-put on record ko sa lahat ng mga kapo-senador and our resource persons. So dito pa rin sa drug testing, meron din pong argument na it's not cost-effective. In 2009, it was reported that it would take the Philippines 4 years and 25 million pesos to conduct nationwide drug testing. And even then, the results would only be limited to shabu and marijuana. Second to the last, there may argument na drug testing promotes riskier drug test-taking behavior. So another irony, the knowledge of a forthcoming drug test, well, kung alam nila, only encourages the use of substances that are detectable for short periods rather than substances that stay longer, and could also encourage binge drinking. And I share pala yung concern, Mr. Chairman, ni Chairperson Aiza about parenting. Definitely, first line of defense. And last question or point na gusto kong iiwan kay Chairperson Aiza for her and her commission's input in a future hearing, yung sinabi rin po ni na Asek Punsala na stigmatizing. Drug testing, doon na nga, kung mishandled, lalo na sa mga youth, becomes tantamount to a witch hunt, implying that the student is guilty until proven innocent. Add to this the stigma brought by suspension or expulsion, possibly, and the stigma and even danger of being sent to rehab for a positive test, which could further exacerbate the reasons why a student uses drugs and could push them to riskier behavior. So last comment na lang po, Mr. Chairman, with thanks to all our resource persons, especially from the PNP and the NYC, and of course DOH and my favorite PhilHealth. I'd just like to reiterate, Mr. Chairman, that yes, drug use and drug dependence is a public health issue. And we need, Mr. Chairman, to shift the focus of this war on drugs from punishment to treatment. Maraming salamat po, Mr. Chairman, at sa lahat.
Thank you, Senator Risa.